Message, 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 message. Healthcare simplified. Healthcare simplified.
Okay. Good afternoon. So, if I'm not loud enough, I would love you to respond in the comment section so that my voice projection is loud enough for you to get what I'm saying, so that we can interact. You can drop the comment in the comment section, then we can interact. So first of all, my name is Dr. Lupinda a registrar of urology, practicing from the Levy Mwanawasa Teaching Hospital. I would like to thank Message Zambia for giving me this opportunity to go live on their page and discuss some of the most important topics in urology. In this case, erectile dysfunction. This is a condition which is sidelined because of the privacy of the patient, as well as a man's self-esteem and a self-confidence, because it affects all these areas of a man's sexual life and social and psychosocial life. So in a series of tabulated points, I'll describe what erectile dysfunction is by giving its definition. Then I'll also highlight some of the causes of erectile dysfunction, and then I'll go on to some of the preventive measures which somebody who's having this condition can take in order to abate or reduce the risk of them having erectile dysfunction. And then I'm going to also highlight how we manage this condition in men. And then lastly, I'm going to put a few points as into why on the treatment we should only stick with conventional medicine, that is medicines which have gone through the lab, have been tested through clinical trials, so that you get the best outcome as compared to going to the streets. You know, there are so many herbal medications on the street which are being sold without any license or anything like that. So we'll also have a look at how harmful they can be to your health when it comes to trying to solve the problem of erectile dysfunction in men. So what is erectile dysfunction? So erectile dysfunction is the failure of a man who's sexually active to sustain and attain a quality erection which is erect enough or firm enough for them to perform a sexual intercourse which is penetrative, satisfactory to both the partner and the person as well, able to reach climax and orgasmic phase. So this is how we define erectile dysfunction. So when somebody is unable to attain and maintain an erection firm enough to cause penetration and have a sexual intercourse. So this failure to achieve this erection can happen at the beginning or midway as the person interacts in a sexual way, in this case in a man. So if you're not able to attain that erection at the beginning, or you can attain it at the beginning but fail to maintain it until you reach climax and possible orgasm, that's coined as erectile dysfunction. And it has to be consistent. It has to be happening consistently over time, over and over again. And actually it's self-diagnosed. You will notice that actually this has never happened to you. It's a problem that you will encounter there and then, and you will notice to say, this has never happened to me. And then you come to your doctor and get checked. So men have to take note that problems with having an erection sometimes shouldn't be a very big concern, because it happens sometimes. You could be anxious, you could have some sort of stress at some point. So sometimes you might have a problem having an erection, but it depends on how frequent that problem comes about for it to qualify to be erectile dysfunction. So whenever you have a weak erection at one instant, it doesn't qualify to be the condition which we are terming erectile dysfunction for you to seek medical help. So it has to be consistent in occurrence for it to be coined erectile dysfunction. And then you can come to the hospital and seek medical help. So one thing you have to understand about sexual arousal and the mechanism of an erection is that it's a complex mechanism which involves nerves, the brain, blood vessels, the heart, as well as hormones. So it's a complex mechanism for sexual arousal in terms of an erection to occur. So then one other thing that you have to point out is erectile dysfunction is an underlying or an indicator of an underlying cause or a disease. So in this case, it could either be a physical, or what we call a physical cause or a medical cause, or it could be a psychological cause. I hope you are getting me on this one. So erectile dysfunction is a sign or a symptom of something else. So once you start seeing this, it could be as a result of something which is underlying. There's a disease at the back which is causing erectile dysfunction. So now I'm going to describe some of the causes of erectile dysfunction in terms of two categories. So in this case, we've got medical causes of erectile dysfunction as well as psychological causes. So amongst the medical causes, these are like diseases which somebody has which are manifesting as erectile dysfunction. And we have got psychological causes as well, which are affecting your brain, your mind, and are portraying as erectile dysfunction. I hope you're getting me clear on that one. So some of the medical causes of erectile dysfunction. First things first, your age. So men will attest to it that when you are younger, maybe when you are 18, somewhere around 18, 19, 15, somewhere there, you might find that the quality of your erection won't be compared to the time that you are reaching somewhere around 45 and 40 going above. You might see that change. That's called a physiological change. So you are more prone to have erectile dysfunction as you grow older. I hope you are getting me clear on that one. When you are younger, your erection and the quality of the erection and how you maintain it is going to be different as you grow older. That's a normal physiological change. So age is one of the causes of erectile dysfunction. So these physiological causes are coming in as your body is physiologically wearing out as you grow. So that's a cause of erectile dysfunction. As I mentioned earlier, an erection is a complex mechanism altogether involving the brain, the nerves, the blood vessels, as well as hormones. So if you have any insult or disease which is affecting any of these structures or organs that I've mentioned, you are prone to have erectile dysfunction. And in this case, the biggest culprit being heart conditions. When your heart is not pumping blood at a rate which is required normally, because the mechanism of an erection is that it needs a proper functioning blood vessels to supply blood adequately for the erection to be stiff enough. So if your heart is not pumping blood at the right rate, adequately, you'll be prone to erectile dysfunction. So all sorts of heart conditions are going to render you to have erectile dysfunction. So it could be one of the first signs that you've got a heart problem altogether when you see erectile dysfunction happening to you. That's why I was saying it portrays an underlying disease. So in this case, cardiac disease or heart diseases can cause erectile dysfunction. So we mentioned age. So as you grow older, you become a little bit weaker. So in that category, one of the causes is a condition called aortoiliac sclerosis. This is where your blood vessels, remember I mentioned blood vessels as being a part of this complex mechanism for you to have a good erection, because of the blood supply, or the flow to the penis is important for you to have a quality erection. So if you have clogged up blood vessels, a condition called atherosclerosis, this is where you have got high cholesterol levels in your blood, and then they clog up these blood vessels which supply the pelvic area as well as the penis. So you won't be able to receive enough blood for you to achieve a quality and a firm enough erection. High blood pressure as well is one of the causes of erectile dysfunction, together with some medications which are used in the treatment of high blood pressure. Due to their mechanism of action, you find that they interact with how an erection is supposed to come in an inhibitory way. So once this inhibition occurs and you are taking that medication for hypertension, as well as conditions like prostate cancer, and a condition where there's an enlargement of your prostate in men, a condition called benign prostate hyperplasia. When you are taking these medications, they will interact in a mechanism which alters the quality of the erection. So these are some of the causes. Another culprit is diabetes. Most diabetic patients will attest to having problems having an erection due to these mechanisms which I've mentioned. Clogging up of blood vessels. And another addition, most diabetics will complain of having a condition called peripheral neuropathy, or numbness in the fingers and the feet. This numbness just doesn't affect these organs that I've mentioned, the fingers, the feet. It also affects the penis on the sensation. You know, sex is arousal is supposed to be tactile, or touch stimulated. So if the touch is reduced, or the sensation is reduced, you might find that this person will be prone to erectile dysfunction. So diabetes is a cause of erectile dysfunction. Another cause is alcoholism. You should distinguish alcoholism from taking alcohol. So alcohol affects your erection in that some men will attest to that, to say no, when I drink 2 or 3 beers, I'll have a better and firm erection. You might want to notice that at first alcohol is a stimulant, so it will stimulate you to have a quality erection at some point, but it has got a phase where it causes depression as well. So once it kicks the depressive phase, that's why you might find that in the morning you might find that you are having a problem to have an erection as a result of dehydration and the effects of alcohol on the heart, as well as the nerves. So alcoholism is a cause of erectile dysfunction. Another cause is cigarette smoking. So cigarettes are bad for your health in other areas, as well as erectile dysfunction as a cause. So cigarettes or smoke produces some certain carcinogens which are harmful to the liver, and as well as to the blood, and will render you to have problems with your blood vessels. As I mentioned earlier, your blood vessels are very important in giving you a quality erection. Other causes include hormonal imbalances. You might find this a term very common amongst women who have problems in conceiving and all that, but hormonal imbalances also occur in men. There's a hormone called testosterone, which is produced by the testicles of a male genitalia. So this hormone is responsible for male secondary sexual characteristics when a man is developing, as well as a man's sexual drive. So if you have this hormone deficient or reduced, you are going to have problems having a quality erection. Other causes include accidents which are affecting your spine. Remember, I mentioned that an erection is a complex mechanism altogether involving the brain, nerves, blood vessels, as well as hormones. In this case, we're talking about nerves. So if you've had an injury to the spine, the spine on the lumbar area or the sacral area of nerves which are supplying the pelvic area, and eventually will supply the penis as well. So if you have had any accident or any surgery which altered this area or caused injury to this area, you might find that you start having erectile dysfunction, in the same categories as strokes as well. So these are some of the causes of erectile dysfunction. A sedentary lifestyle as well is one of the causes. You might find that people who are obese, as I mentioned earlier, we've got a lot of cholesterol accumulating in the blood vessels, clogging up the blood which is supposed to be supplied to the penis area. You might find that you'll be prone to erectile dysfunction. So how would you prevent some of these things which cause erectile dysfunction? So first things first, you need, as a man, to be having regular checkups, because we mentioned that erectile dysfunction is like a projection of an underlying cause of disease which is hiding somewhere. So once you start having these issues as early as possible, you reach out to your GP so that they can have a look at you and treat the underlying cause of the disease. So you're also supposed to have regular exercises. Men nowadays are hitting the gym day in, day out. But one other thing that they are forgetting whilst they're at the gym is that they're trying to increase muscle bulk now by using anabolic steroids. So anabolic steroids are not good for you in that they reduce the level of testosterone. Remember that manly hormone which I mentioned, which is drives a man's sexual drive, as well as responsible for a man's secondary sexual characteristic as well. So once you take anabolic steroids, you are rendering yourself prone to suffer erectile dysfunction. So regular exercise is good for you to prevent erectile dysfunction. So now, if you have the condition already, how is it diagnosed when you come to the hospital? So ideally, it's self-diagnosed, as I mentioned earlier, because the man is going to notice the problem on their own without anybody else complaining. You will notice to say, the quality of the erection that I've been having is not as good as it were previously. So you come to the hospital, and then once you present yourself to the hospital in an environment where you have it's secure and confidentiality is guaranteed, your general practitioner or your doctor is going to ask you a few questions to rule out a possible cause. So as I mentioned earlier, amongst the causes which are medical as well as psychological. So amongst the psychological, which I should have mentioned earlier, are stress, as well as depression. So your medical doctor is going to ask you questions by taking a history, which is going to point out exactly which one is the cause. Either is it medical or is it a psychological cause. So once they take the history, they'll do a little bit of some tests on you. They'll check your testosterone levels. They'll do a physical exam on you, and then once we make that diagnosis, there's help. So there are all ranges of medications which are used in the management of erectile dysfunction, starting from tablets, injectables, as well as surgery. So among the tablets, I'm sure you've heard a lot about a drug called Viagra. It's a chemical name being sildenafil citrate. We use it quite a lot, as well as other categories of oral medications. We also have injectable medications as well, which we give to treat the erectile dysfunction. And you might find that sometimes, as I mentioned earlier, that it's a projection of an underlying cause. Once we treat the underlying cause, in this case, let's say the cause is as a result of diabetes or hypertension. Once we treat the hypertension or the diabetes, the condition resolves on its own. Then the last option when it comes to management of erectile dysfunction is a surgical treatment. In this case, we do put implants in the penis shaft, and a man is able to use a pump using manually, where you can pump it and get an erection and be able to have a sexual intercourse. So now that you've heard that there are all these type of medications that we use to treat erectile dysfunction, you might want to know that I haven't put any herbal or non-conventional medications in the treatment of erectile dysfunction. So it is very important that you get treated with conventional medicines which have been certified in the lab, which have gone a clinical trial, efficacy guaranteed, as well as side effects which are known, rather than going to the streets to get all sorts of medications. They have got all sorts of names. Mutototo, 7 days, Congo Das, name them. They are all out there. I'm sure you've heard about them. One thing we don't know about these medications is that we don't know their contents. We don't know their effects on other organs. You know, the body is made up of so many organs. There's a brain, there's kidneys, there are blood vessels, there's blood as well. So you need to be cautious on this, because we don't know the contents of these medications. So they could cause all sorts of damages in the body without you actually knowing. And one most common side effect of this medication is a condition called priapism. Ideally, an erection is not supposed to go for more than 4 hours. When it passes 4 hours, there are consequences. And this is what these medicines do. So I mentioned earlier on the mechanism of the erection that it needs an adequate supply of blood. So as the blood is being pumped to the penis, which is the organ of interest in this condition, it keeps on being pumped for the next 4 hours and more. So blood gets clogged up if it reaches more than 4 hours. So this condition makes the tissues around the erectile tissue of the penis to be prone to what is called ischemia, or reduced oxygen levels, because this blood becomes stuck or stagnant to this organ for a very long time. So it damages this tissue to the extent where you cannot have an erection again. And because of the nature of this condition, which I've mentioned, brought up as a side effect of these non-conventional medications, herbal medications, which are found on the street, you might find that a man cannot come to the hospital rushing with an erection because they'll feel shy. So they'll tend to show up to the hospital very late again. That's another problem. When you show up late, because these tissues, as I mentioned, they are undergoing a condition called ischemia, where there's reduced oxygen supply to this organ. And you know, the body functions on oxygen. The tissues are perfused with oxygen, then the healthier they are. So if the oxygen is not reaching these tissues for 3, 4, 5 days or so, they now start to undergo another process called necrosis, which is, in a layman's language, rotting. So if it reaches this extent where now the tissues of the penis becomes rotten, you will never use this organ again in this way. When you come to the hospital, it either needs to be, the tissue which is rotten will need to be cut off completely, and you will never use the penis or this organ again. So that's a cautionary measure when it comes to using non-conventional medications. So that is all we had today about erectile dysfunction. So I'm going to read out some questions that you've been putting up in the comment section. There's one question where somebody was telling me, can masturbation cause erectile dysfunction? No, masturbation does not cause erectile dysfunction at all. Masturbation is not related to erectile dysfunction at all. It's a very, very complex mechanism when it comes to having an erection, but masturbation cannot cause erectile dysfunction. Masturbation can cause other things, maybe things like where after you have masturbated, but then you can't get it up as a result of you already having reached the orgasm or climax, then it can come up, but it cannot be a cause of erectile dysfunction. So I'll check again on the comment section if there's any other question pertaining to erectile dysfunction. Apparently there's no other question. So I hope the topic was quite clear. The topic was quite clear, so I would urge you to download the MedSage app and make sure that it's in your phone, it's in your laptop, for you to easily access some of the medical tips and the do's and don'ts. It's got a wide coverage of topics which you can find in your own time, in your own space, on your phone, on your laptop, whilst you are doing that. So once more, I would like to thank MedSage Zambia for giving me this opportunity to feature on their page and go live and educate the masses on erectile dysfunction. I'm Dr. Lupinda. I also have a Facebook page which you can follow. The name is Dr. C.K. Lupinda Urology Care. You can go to my page. I post a lot of urology conditions as well as other conditions affecting one's health. Thank you very much for your attention. Have a pleasant afternoon.
Message.